Hello everyone. Cervical cancer is the fourth most common cancer in women across the globe. And did you know that in India alone, cervical cancer is considered to be the second most common cancer in women after breast cancer? And these are alarming statistics. My name is Richa Bansal and I am a fitness enthusiast and a nutritionist as well. Today we have with us gynec oncology surgeon Dr. Richa Bansal, who is from Apollo Hospitals, Navi Mumbai, and she's here to talk to us about cervical cancer and all of those questions जो हमारे मन में रहते हैं, हमें कैसे पता चलेगा cervical cancer है, टेस्ट कराने चाहिए कि नहीं चाहिए, you know, etc. etc. So thank you so much, doctor, for joining us today.
Most welcome. It's my pleasure.
सबसे पहला question, cervical cancer क्या होता है and इसके causes क्या हैं?
Yes. So cervical cancer is actually the cancer of the mouth of the uterus.
Okay.
Yes.
All
So
right.
uterus का two parts होते हैं.
हाँ
One
जी.
is the main body of the uterus
Right.
and the mouth of the uterus. And you know, when the abnormal cells grow in that part, it is called cervical cancer.
Okay.
सर्वाइकल कैंसर का जो मेन कारण है वो है एक वायरस विच इज HPV वायरस, ह्यूमन पैपिलोमा वायरस, एंड इट इज एक्चुअली द मोस्ट कॉमन सेक्शुअली ट्रांसमिटेड इन्फेक्शन. HPV infection is the most common sexually transmitted infection. Almost 90% of the couples, whenever they start their sexual debut, 90% of the couples will acquire this HPV virus infection in their genital organs.
Okay.
You know, within 6 to 12 months of their marriage, or you know, whenever they start their sexual debut.
Okay.
At the same time, 90% of these couples will be able to clear this virus just spontaneously.
अच्छा.
You know, with the help of their own body's immunity.
Oh.
So
that is good.
Yes. So ये है भी बहुत ज्यादा कॉमन HPV वायरस इन्फेक्शन. इट इज वेरी कॉमन, और बॉडी उसको अपने आप ही क्लियर भी कर लेती है उतना कॉमनली, मतलब विदाउट एनीबडी इवन कमिंग टू नो और रियलाइज. वुमेन मे नॉट इवन रियलाइज दैट शी हैड गॉट दिस HPV इन्फेक्शन एंड नाउ शी इज एबल टू क्लियर दिस इन्फेक्शन.
Okay.
Only in those 5 to 10% of the women in whom, due to many reasons, when this HPV virus infection doesn't get cleared from the genitals, these are the ones which are at higher risk of developing cervical cancer.
Okay.
ये जो HPV virus जब persistent रह जाता है genital organs में, तब ये over a period of time ये एबनॉर्मल चेंजेस पैदा करता है सर्विक्स में.
अच्छा. तो
पहले तो ये हम लोग सर्वाइकल प्री कैंसर कहते हैं जिन ये चेंजेस को, विच आर इजीली डिटेक्टेबल विद द हेल्प ऑफ दिस पैप स्मीयर. वी विल टॉक अबाउट इट इन मोर डिटेल. एंड और कुछ टाइम बाद ये सर्वाइकल एबनॉर्मल चेंजेस और सर्वाइकल प्री कैंसर, इफ लेफ्ट अनट्रीटेड, इट गोज ऑन टू डेवलप सर्वाइकल कैंसर. So in short, I mean, the main reason for this cervical cancer is this virus, which is HPV virus, and it's a sexually transmitted infection.
So doctor, since you are talking about this, that you know 90% women also kind of acquire it and उनको पता भी नहीं चलता है. But then ऐसे कौन से alarming symptoms हैं that we should keep in our mind that you know, oh my God, this is something which is not normal. I think I need to go and show myself to a doctor. What are those alarming symptoms that we should be careful of?
See, HPV infection के कोई alarming symptoms नहीं हैं.
Okay.
A woman will not be able to realize, or she will not get any symptoms just because of HPV infection.
Okay.
तो HPV infection हम लोग डिटेक्ट तभी कर पाएंगे जब हम पैप स्मीयर करें और HPV टेस्ट करें.
Oh. ठीक है.
So only when you know this abnormal HPV virus will cause these abnormal changes in the cervix, and eventually if it develops into a cancer, symptoms happen only then.
अच्छा.
So this is the reason, and I would also like to highlight in which women this HPV virus has more chances of remaining persistent.
Exactly.
Yes. हालांकि ये जो रीजंस हैं ये बहुत कुछ हार्ड एंड फास्ट नहीं है कि सिर्फ इन्हीं महिलाओं में ये परसिस्टेंट रहेगा और बाकी सब में क्लियर हो जाएगा, बट दिस इज व्हाट वी कोरिलेशंस, दीज आर जस्ट द कोरिलेशंस व्हिच वी हैव सीन। तो जो महिलाएं या जो जिनमें सेक्सुअल डेब्यू होता है यू नो एट वेरी अर्ली एज, probably less than 18 years of age. यहाँ पे क्योंकि सर्वाइकल सेल्स उतने डेवलप
अभी वो फॉर्म हो रहे हैं,
yes, the you know they're still getting mature, body's immunity is still getting matured. So when a young girl gets exposed to this HPV virus, she's more prone that you know this virus will remain persistent in her genitals and it will not get cleared.
ठीक है।
Then second reason है having first childbirth at less than 21 years of age.
Okay.
Early sexual debut, early childbearing. Then multiple childbirths. With every childbirth there is some micro trauma caused to the cervix.
Correct.
And which facilitates this virus entry into the cervix.
Okay.
And helps the virus, you know, remaining persistent in the cervix. Then we also say multiple sexual partners, and if the partner has a lot of you know tendency to have these sexually transmitted infections, probably because of hygiene issues and so on. And yeah, so these are the reasons, and of course immunodeficiency, the women with you know HIV infection, or women who are on long-term steroids therapy because of many reasons, like transplant recipients and all. These are the patients, or these are the women which may have higher risk of developing cervical cancer.
Sure. Doctor, so you also spoke about pap smear test. Let's just talk a little more about pap smear, because देखा गया है कि बहुत सारी ऐसी women है, I think so many women, the moment you say कि आपका pap smear test होगा, उनके कान खड़े हो जाते हैं, and they are like नहीं, pap smear test नहीं कराना. So through this conversation I also understand that pap smear test क्यों important है, obviously because that is a test which will further determine that you know do you have cervical cancer or not.
Yes.
One of the main findings of it. But also when you talk about pap smear में और pelvic examination में क्या फर्क होता है?
Yes. So pap smear test is simply, you know, collecting some cervical smear or cervical secretions with the help of a spatula.
Right.
It's a simple instrument actually.
Correct.
And studying these secretions or this cervical smear under a microscope to see which kind of cells are there, or whether these cervical cells are normal or are there any abnormal HPV induced changes in the cells. तो पैप स्मीयर टेस्ट मतलब हार्डली 2 मिनट लगते हैं, कोई भी गायनेकोलॉजिस्ट अपने ओपीडी में ये टेस्ट कर सकते हैं. यू नो इट्स एब्सोल्युटली पेनलेस एंड यू नो हार्डली टेक्स 2 मिनट्स. इट्स इवन सिंपलर देन यू नो गोइंग टू अ डॉक्टर फॉर ड्रॉइंग ब्लड. ब्लड टेस्ट करने से भी ज्यादा सिंपल है मतलब एक्चुअली. पेल्विक एग्जामिनेशन वो होता है जब एक गायनेकोलॉजिस्ट यू नो हम लोग जब एक स्पेकुलम यूज करते हैं एंड व्हेन वी यूज आवर फिंगर्स टू यू नो असेस द पेल्विक ऑर्गन्स. So pap smear is like during the pelvic examination we just collect a smear, right, and we send it for testing. Correct. पैप स्मीयर के साथ हमको एक और टेस्ट है जो HPV टेस्ट है, वो भी करना चाहिए. पैप स्मीयर बताएगा कि सर्वाइकल सेल्स एबनॉर्मल है या नहीं, और HPV टेस्ट बताएगा कि सर्वाइकल सिक्रीशंस में ये परसिस्टेंट HPV इन्फेक्शन जो हम बात कर रहे हैं ये है कि नहीं. सो जैसे नॉर्मली जो एज ऑफ यू नो सेक्सुअल फर्स्ट सेक्सुअल एक्सपोजर है जो यूजुअली इट इज यू नो ऑन एन एवरेज इन आवर कंट्री इट इज इन अर्ली 20s. एंड सपोज इफ वी आर टेस्टिंग 38-year-old woman with the pap smear and HPV test, and if suppose HPV test she tests positive for HPV, then you know there is a reason to believe that probably she is having you know this persistent HPV infection, and this alarms us, and then we just tell her to do this test more frequently, so that we come to know whether this HPV virus is clearing from her body or not.
Correct.
So this will eventually tell us whether she's at higher risk of developing a cervical precancer or cancer.
Sure. And also, since you are now talking about age groups and all of that, what we would also like to understand from you, Dr. Bansal, is that what is the right age to start getting your pap smear done? That's one. And second, again age related है, that आपको कितने frequency में pap smear करवाना चाहिए?
Yes. So ideal age is starting from age 30 and up to 65 years of age.
ठीक है.
एंड फ्रीक्वेंसी अगर आप पूछेंगे तो अगर हम सिर्फ पैप स्मीयर कर रहे हैं तो वुमेन नीड्स टू डू इट एवरी 3 years.
Okay.
And if we are combining this pap smear with HPV, because when these two tests are combined, the results are more reassuring. If both the tests have come negative, then I'm more reassured that she's protected for a longer period of time.
Okay.
So अगर हम दोनों टेस्ट कर रहे हैं तो हम इसका इंटरवल बढ़ा सकते हैं for every 4 to 5 years.
Okay. Then that is
it's quite
pretty
reasonable actually.
Pretty
I mean,
reasonable.
hardly 2 minutes examination test, which is absolutely painless and which you have to do every 3 years or every 5 years.
So ladies out there, I hope you realize डरने की जरूरत नहीं है, uncomfortable भी होने की जरूरत नहीं है.
Exactly.
It's just a doctor that's examining you. Okay, so coming on, doctor, एक question आया था, which was, is cervical cancer hereditary? What are your thoughts on this?
Yes, cervical cancer is not hereditary.
Okay.
Because we know that it is due to an environmental factor, which is a virus.
Correct.
So cervical cancer is in no way genetic or hereditary, and I think that is quite reassuring.
Absolutely, thank you so much. So, doctor, yes, another question is that cervical cancer, yes, we do understand कि this is one of those cancers जो curable भी है, right? But what are the risk factors which are associated with cervical cancer?
So cervical cancer risk factors, as I talked, like it is more common in girls who who have their HPV virus exposure at early age, who have multiple childbirths. But I think we see cervical cancer so commonly, and in majority of the women who walk into my clinic, usually you will never be able to find out if any such risk factor is there or not. So in that way, any sexually active woman or any woman who has been sexually active is at risk for cervical cancer. And definitely it is preventable. And then it is curable. Preventable, I'm saying, because we have very important two tools with us. One is this pap smear and HPV test, which is for women between 30 to 65 years of age. And another equally important tool is HPV vaccination.
Right.
We do have vaccines against this virus, which are Gardasil and Cervarix. The ideal age of vaccination is in adolescence, between 9 to 15 years of age.
Okay.
And if a girl misses that window of opportunity, if she's an 18-year-old girl, or I mean, basically the next ideal is any time before she's exposed to before her sexual exposure.
Okay.
So before she becomes sexually active, a girl should be vaccinated. That is the next best time.
Wow.
And now we will have our indigenous Indian vaccine, which has been approved by the government of India.
Excellent.
And it is now in mass production stage, and soon it will be available in our pharmacies, and it will be the cost will be much less. So we can definitely advise maximum number of people and maximum number of girls to take this vaccine.
Excellent. I think thank you so much, doctor. You have answered so many questions for us, जो बहुत ही basic questions हैं. And women out there, girls out there, especially for you, you know, हम अपने आप को हमेशा बैक सीट पे रखते हैं. I really don't know why. हमारे लिए सारी दुनिया हमसे आगे होती है. हमारे हस्बैंड्स, हमारे बच्चे, हमारे पेरेंट्स, हमारे इन-लॉज. आपके खुद का क्या? I think सबसे पहले अपना ध्यान रखना बहुत 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 ज़रूरी है. And start with these small things like getting a pap smear test done. Get your vaccination done on time. If you've not, please go and get yourself checked by your gynecologist. Discuss with her that, you know, this is what I heard and can you elaborate more about it? इसके बारे में पढ़ो, इसके बारे में सुनो, इसके बारे में बात करो. Talk to people. Thank you so much, Doctor, for your time.
You're most welcome.
And for all of you listeners out there, if you like this conversation that I've had with Dr. Richa Bansal today, please hit a like and do share it with your family, with your friends, with your entire circle. Let's spread awareness on health. Thank you. You take care, stay fit, stay healthy.